Secretary of State for Health, Wes Streeting.
Thank you, Madam Deputy Speaker. With permission, I would like to make a statement on puberty blockers. At the outset, I want to make clear the principles that drive this government's approach to this issue. First, that children's healthcare must always be led by evidence. Medicines prescribed to young people should always be proven to be safe and effective. Second, that evidence-led, effective and safe healthcare must be provided to all who need it when they need it. Third, this is a government that believes in the dignity, worth and equality of every citizen and recognises that trans people too often feel unsafe, unrecognised and unheard. And that must change. None of these simple ambitions have been achieved in recent years. Medicine has been provided on the grounds of insufficient evidence, and young people have been left to go without the support and care they need. This government is determined to change that. The Cass review made clear that there is not enough evidence about the long-term effects of using puberty blockers to treat gender incongruence to know whether they are safe or beneficial. That evidence should have been established before they were ever prescribed for this purpose. It is a scandal that medicine was given to vulnerable young children without the proof that it is safe or effective or through the rigorous safeguards of a clinical trial. Following the Cass review, the NHS ceased the routine use of puberty blockers to treat gender incongruence in children. In May, the previous government issued an emergency order to extend these restrictions to the private sector. In opposition, as Shadow Health and Social Care Secretary, my party and I supported those decisions. Since coming into office, I have renewed this order twice, continuing restrictions until the end of this year. This was done jointly with the Health Minister in Northern Ireland, and I updated the House via written statement. While the temporary ban was in place, I asked the Commission on Human Medicines to look at the current environment for prescribing puberty blockers, and we launched a targeted consultation. Madam Deputy Speaker, the Commission is an independent body made up of leading clinicians and epidemiologists, which advises on medicine safety. They took evidence directly from clinical experts, consultant paediatric endocrinologists, and patient representatives, including representatives of trans people, young people and their families. After thoroughly examining all the available evidence, they have concluded that prescribing puberty blockers to children for the purposes of gender dysphoria in the current prescribing environment represents, and I quote, an unacceptable safety risk. Of particular concern to the Commission was whether these children and their families were provided with enough time and information to give their full and informed consent. The Commission on Human Medicines found that children had received prescriptions after filling out online questionnaires and having one brief Zoom call with prescribers from outside the UK. Consequently, they have recommended that the government should extend the banning order indefinitely until a safe prescribing environment can be established for these medicines. On the basis of their findings, I am acting on the Commission's advice to put an indefinite order in place to restrict the sale or supply of puberty blockers through a prescription issued by either a private UK prescriber or a prescriber registered outside the UK for under 18s. This is the advice from expert clinicians, the Independent Commission on Human Medicines, based on the best available evidence, and follows the cautionary and careful approach recommended by Dr. Cass. The legislation will be updated today and will be reviewed in 2027, along with an updated assessment of the safety of the prescribing environment for these medicines. At the same time, we are working to grow a thorough evidence base for puberty blockers. The National Institute for Health and Care Research is working closely with NHS England to establish a clinical trial into puberty-suppressing hormones. The NIHR is now contracting the team who will deliver the study and are working tirelessly towards recruiting the first patients by spring. The trial is the first of its kind the world over, It will help us better understand the effects of puberty-suppressing hormones in young people, providing the robust evidence required. In addition to establishing the evidence on puberty blockers, the Cass review also made clear recommendations to the government and NHS England for the improvement of healthcare services for children with gender dysphoria. I will now provide an update on the progress made. NHS England has now published its implementation plan to transform its services. It has also published a new services specification to ensure that children and young people experiencing gender incongruence have an appointment with a paediatrician or mental health professional before being referred to specialist services. Dr. Cass was clear on the need for the model of care to change, taking into account children and young people's holistic needs. Since April, NHS England has opened 3 new gender identity services in the North West, in London and in Bristol, with a 4th expected in the east of England by the spring, putting us on track towards opening services in every region by 2026. These services offer a fundamentally different clinical model, bringing together clinical experts in paediatrics, neurodiversity and mental health so care can be tailored to patients' needs. At first, the new services were prioritising patients registered with the old Gender Identity Development Service, but I'm delighted to report that the North West and Bristol services are now taking patients off the general waiting list. On the waiting list, Dr. Cass's review painted a picture of a service unable to cope with demand. Children and young people face unacceptably long waits for care, with some children passing into adulthood before their first appointment, leaving them facing a dangerous cliff edge. I'm pleased to tell the House that NHS England are now working with potential partner organisations to explore establishing a much-needed follow-through service for 17 to 25-year-olds, as Dr. Cass recommended. Young people's distress or their needs don't vanish when they turn 18, and neither should their healthcare. Madam Deputy Speaker, we don't yet know the risks of stopping pubertal hormones at this critical life stage. That is the basis upon which I am making decisions. I'm treading cautiously in this area because the safety of children must come first. There are some who've called on the government not to go ahead with the clinical trial recommended by Dr. Cass. Others, on the opposite side of this debate, want the government to ignore the recommendations of the Independent Expert Commission on Human Medicines. We are taking a different approach. The decisions we take will always be based on the evidence and advice of clinicians, not politics or political pressure. Finally, there are many young people in this country who are desperately worried and frightened by the toxicity of this debate. This has not been helped by some highly irresponsible public statements which threaten to put vulnerable young people at risk. In the past few months, I have met with young trans people who have either been, may be, or will be affected by the decisions I and my predecessor have taken. I've listened to their concerns, their fears, and their anxieties, and I want to talk to them directly now. I know it's not easy being a trans kid in our country today. The trans community is at the wrong end of all of the statistics for mental ill health, self-harm, and suicide. I can't pretend to know what that's like, but I do know what it's like to feel you have to bury a secret about yourself, to be afraid of who you are, to be bullied for it, and then to experience the liberating experience of coming out. I know it won't feel like it based on the decisions I'm taking today, but I really do care about this, and so does this government. I'm determined to improve the quality of care and access to healthcare for all trans people. I'm convinced that the full implementation of the Cass Review will deliver material improvements in the well-being, safety, and dignity of trans people of all ages. And this government will work with them to help them live freely, equally, and with the dignity that everyone in our country deserves. And I commend this statement to the House. Yeah.